Question 75, which of the following structures was most likely injured? Cerebellar arteries, emissary veins, meningeal arteries, bridging veins, blah, blah, blah. Okay, so probably a neuro question, either stroke or one of those hematoma questions. Let's find out. 6-month-old boy is brought to the ED due to decreased responsiveness. His babysitter states that he was alert earlier, but became progressively less active and irritable after a nap. On exam, he is difficult to arouse and exhibits episodes of abnormal posturing. The anterior fontanelle is full and tense, meaning there's probably increased intracranial pressure. A non-contrast head CT reveals a crescent-shaped hyperdensity along the left cerebral hemisphere, extending front to back. No skull fractures are present. Okay, so crescent-shaped hyperdensity. This is iconic intracranial hemorrhage type question. And this is our second intracranial hemorrhage question that we've seen in this pre-test self-assessment. So I'm just going to use the drawing I made earlier. They call them crescent, lens shaped. I like to refer to them as different types of fruit. So if you see a lemon, or a lens as they like to call it, the lemon is your epidural hemorrhage. This is your middle meningeal artery laceration, classically from high impact trauma. So we don't have a lens shape as they like to describe it, or the lemon, no lemon. So I'm going to cross off our meningeal arteries. Also, there was no mention of trauma. However, got to be careful on these. How did he get this while taking a nap, right? If this was an ethics question, the correct answer would be to contact CPS immediately, but it's not. So this is probably child abuse. Child abuse is very commonly seen in questions with ecchymoses over the anterior posterior ribs. You have to envision your strong, meaty hands around a tiny baby's rib cage, shaking it back and forth, and that's where the ecchymoses are coming from, over the ribs anteriorly and posteriorly. It's from your finger pads. Absolutely phenomenal imagery. The other one, just so same thing, same picture in your head, shaking a baby back and forth. I know it's terrible. Just bear with me. What is the baby's head doing? Don't think about it too hard. It's shaking back and forth. Okay, so that's where the intracranial hemorrhage comes into play. So shaken baby syndrome is the rib bruising or fractures plus intracranial hemorrhage, and it's classically a crescent, or as I like to call it, a banana shape. So when you see the banana on CT, or if they call it crescent, you're thinking subdural hemorrhage. Subdural hemorrhage is classically from your bridging veins. It doesn't have to be high impact, but it can be in this case. You also see subdural hemorrhage in elderly people. It can be from as little as a fall, with or without hitting their head. Just a quick impact can shake up those bridging veins. And I just like to think of them as being between two layers, and the bridging veins are kind of just traveling between these two layers. And if something causes one layer to shift in one direction and the other to shift in the other direction, then these bridging veins are lacerated. So the correct answer here are your bridging veins with choice D. If you're thinking vertebral arteries, you should be thinking brainstem stroke. So that's out. Same with the cerebellar arteries, brainstem or cerebellar strokes. Emissary veins bridge the gap between the inside of the cranium and the outside. So these typically aren't involved in hemorrhages, hematomas, or strokes. These are actually important in infections because they don't have valves. So infections can kind of just travel back and forth from the outside of the head to the inside that way. But regardless, it's out. Shaken baby syndrome, really important, not very fun. So this is shaken baby syndrome. Make sure you know that. Bruises on the ribs, subdural hematoma on CT.